Your spine is a marvel of engineering. It provides support, it allows movement, it protects vital nerves. Its health is truly fundamental to your overall well-being. Without a healthy spine, simple daily activities become difficult. Life's quality can diminish significantly. Many people, however, neglect this crucial structure. This neglect often leads to problems. Back and neck pain are extraordinarily common today. Millions experience this discomfort. Our lifestyles contribute significantly to this problem. We sit for too long, we stare at screens, we are often under immense stress. These factors create a perfect storm for spinal distress. This essay aims to explore this widespread issue. We will look at the common causes of back and neck pain. Poor posture is frequently blamed for back and neck pain. People slouch at desks. They crane their necks over phones. A sedentary lifestyle is another common suspect. Lack of movement weakens muscles. It makes the spine less resilient. These are physical factors certainly. They can contribute to temporary discomfort. However, they are rarely the primary cause of chronic persistent pain. The body is designed to adapt. Injuries and physical strain are also cited. A sudden awkward lift can cause acute pain. A fall or accident can damage tissues. These events are real. But why does pain sometimes persist long after tissues should have healed? This is a critical question. Degenerative conditions like arthritis or disc disease are often identified on scans. Doctors point to these findings as the cause of pain. Persistent pain is a key signal that something might be wrong. Pain that lingers for weeks or even months is a clear indication that it's not just a minor issue. Pain that does not resolve with typical rest or simple remedies like over-the-counter medications or heating pads should be taken seriously. This is not ordinary muscle soreness that goes away after a good night's sleep or a day of rest. This kind of pain demands attention from a healthcare professional to determine the underlying cause. Radiating pain is another important sign that should not be ignored. Pain that travels from your neck down your arm can indicate nerve involvement, or from your back down your leg, which is often more than just a simple muscle strain. This is often called sciatica when it affects the leg, and it can be quite debilitating. It can be quite alarming and should prompt you to seek medical advice. Numbness or tingling sensations in any part of your body should not be ignored. These feelings in your arms, hands, legs, or feet can indicate nerve involvement and require professional evaluation. Weakness in a limb is also a serious symptom that should not be overlooked. If you find it hard to grip objects or if your hand feels weak, it's a red flag. Or if your leg feels like it might give way while walking, these are significant warning signs. They suggest that nerves might be compromised, which can lead to more serious issues if not addressed, or that the condition is more complex than a simple strain, requiring a thorough medical evaluation. Section 4. Fortifying your foundation strategies for pain prevention. Many talk about correct posture. Sit up straight, keep your shoulders back. These are common pieces of advice. While good posture has its place, obsessing over it can be counterproductive. It can create more tension. The body is naturally designed for various positions. The key is not rigid adherence to one perfect posture. Rather, it is about mindful awareness and avoiding prolonged static positions. Gentle movement is more important. Creating an ergonomic setup is often recommended. Adjustable chairs, monitor stands, and special keyboards. These can help reduce physical strain, especially if you work long hours at a computer. This is sensible. It can prevent some acute discomfort. However, an ergonomic paradise will not prevent TMS. If unconscious emotional tension is present, pain can still arise, regardless of how perfect your chair is. Section 5. Navigating relief, understanding treatment pathways for pain. Physical therapy is a common treatment for back and neck pain. It is often the first line of defense recommended by healthcare professionals. It often involves exercises, stretching, and manual techniques. These methods aim to improve mobility and reduce discomfort. For acute injuries, this can be helpful. Physical therapy can accelerate the healing process and restore function. It can aid in recovery, helping patients regain strength and flexibility. However, for chronic pain due to TMS, its benefits are often temporary. Chronic pain requires a different approach. If the underlying emotional tension is not addressed, the pain will likely return. Emotional and psychological factors play a significant role, or it may move to another part of the body. This phenomenon is known as pain migration. The focus must be on the root cause. Identifying and addressing the true source of pain is crucial for long-term relief. Heat and cold therapy can provide temporary symptom relief. These methods are simple yet effective for short-term comfort. Medications like pain relievers or anti-inflammatories can also reduce discomfort. They are often used to manage pain levels. These can make life more bearable in the short term. However, they are not a permanent solution, but they do not cure chronic pain. The underlying issues remain unresolved, they merely mask the symptoms. This can lead to a cycle of dependency without true healing. Long-term reliance on medication can have side effects. These can range from mild to severe, impacting overall health. And it does nothing to address the TMS mechanism. Understanding the mind-body connection is essential. True healing comes from understanding, not from a pill. Education and awareness are key components of effective treatment. Professional treatments like chiropractic care or injections are also sought. These methods can provide relief for some patients. Some people find temporary relief from these methods. However, the relief is often short-lived. Again, if the pain is due to TMS, these interventions are treating the symptom, not the cause. The root issue remains unaddressed. The perceived structural abnormality they target is often not the true source of the pain. Misdiagnosis can lead to ineffective treatments. Section 6. The Mind's Dominion, a deeper look at pain's true origin. The concept of the mind-body connection is not new, yet it is often dismissed in Western medicine, especially when it comes to chronic pain. We are conditioned to seek purely physical explanations. A torn muscle, a slipped disc, a pinched nerve, these are tangible, they seem like straightforward culprits. However, the brain is the most complex organ. Its influence over the body is immense. It can and does create real physical changes. Repressed emotions are a powerful force: anger, anxiety, guilt, and fear. When these feelings are not consciously acknowledged and processed, they create internal tension. The brain, in an attempt to protect you from these overwhelming emotions, may create a physical symptom. Section 7. Conclusion: Embracing knowledge for a pain-free future. We have explored the landscape of back and neck pain, delving into its complexities and the various factors that contribute to it. Its prevalence is undeniable in our modern world, affecting millions of people globally and impacting their daily lives. The causes are often misunderstood, leading to frustration and prolonged suffering for many individuals. Conventional thinking points to posture, injuries, or degeneration as the primary culprits. While these can play a role in acute pain, they are not the full story for chronic conditions, which often persist despite these interventions. The mind, specifically unconscious emotional tension, is a powerful generator of real, physical pain that can be just as debilitating as any physical injury. This is the core of TMS, or tension myositis syndrome, a condition where emotional stress manifests as physical pain. Most chronic back and neck pain is manageable and can be significantly reduced with the right approach. It is not something you have to live with forever. Relief is possible and within reach. This is a message of hope, a reminder that you can reclaim your life from chronic pain. However, effective management requires a shift in perspective, an openness to exploring the mind-body connection. It requires looking beyond purely physical treatments and considering the emotional and psychological factors at play. It demands an understanding of the mind-body connection. The pain is real, but its origin is often in the brain, not in a damaged structure. This understanding is liberating, offering a new pathway to healing and a pain-free future. Take proactive steps towards your spinal well-being, incorporating both physical and emotional health practices. This involves more than just ergonomic chairs or exercises. It involves emotional awareness, mindfulness, and a commitment to understanding your own body and mind.